Good evening. My name is Dr. Tim Dombrowski, and I want to welcome all of you here tonight. The title started off a week ago as being Swine Flu, an interprofessional update of what you need to know. But now we realize that we're not calling it the swine flu anymore. We're calling it H1N1 flu or influenza. But I want to thank you for coming and taking the time from your busy days and your schedules to be here this evening. I also want to thank our panelists, who I'll introduce in just a moment, as well as our marketing department and our media department for getting this underway in just a week. We started working on this 7 days ago, and the promotion and the advertisements were a tremendous effort on their part. Our panelists this evening come from a couple different areas and specialties, and the first speaker, well, I'm just going to mention individually, is Dr. David Condalucci. Dr. Condalucci is a clinical professor of medicine. He's a volunteer faculty member in the Department of Medicine here at the school, UMDNJ, and he's also Chief of Infectious Diseases at Kennedy Hospital. Dr. Olivia Bratis will be our second speaker. She's an assistant professor of medicine and a full-time faculty member in the Pulmonary Critical Care Division of the Department of Medicine. And she's also medical director for ICU, the intensive care unit in the hospital here at Stratford. Dr. Jackie Carey is going to be our third speaker. She's an assistant professor of medicine and a full-time faculty member and the acting chairperson for pediatrics here at UMDNJ. And our fourth panelist is Dr. George DiFerdinando, who's an adjunct professor of epidemiology and with the New Jersey Center for Public Health Preparedness at UMDNJ in the School of Public Health. This whole process has been going on for about the last 7 to 10 days. And I think we've all heard and seen a lot of changes going on with this particular pandemic that's been reported. From the CDC website from April 26th, which was Tuesday a week ago, there were 20 cases in the United States and there were no deaths. Today on the CDC website, it's reported that there were 41 states involved, that there were 642 cases in the United States that have been diagnosed, and there have been 2 deaths, and both deaths occurred in the state of Texas. The spread of this disease is through a respiratory source, whether you cough or you sneeze, and you end up causing the virus to become airborne, and somebody has contact with that in terms of what they breathe, or these individuals who are infected cough and sneeze on their hands, and then touch something else that becomes contaminated, and another person who's uninfected touches the book or the piece of paper, and now they're contaminated, and then they infect themselves. So that's the way that the transmission actually occurs. They believe that the incubation time is about 1 to 4 days. So you're exposed to it and don't have the actual infectious symptoms for several days. It probably lasts about 7 days, and you're not supposed to return to work until it's about 7 days after the onset of the disease, or until you're disease-free for about 24 hours. Usually the symptoms are fevers and chills, respiratory symptoms such as cough, sore throat, sneezing. You might have a headache, a lot of muscle aches or joint aches, and some people even get vomiting and diarrhea. The syndrome has complications, but they're not exactly sure of this particular swine flu and whether or not those complications are going to hold true for them. Initially, when this started in Mexico about a week or 10 days ago, the early information was that these people were previously healthy young people who were getting sick, and they were being hospitalized, and they were seeing a pneumonia that was progressing very, very rapidly. These young people were then going on to ventilators because they had developed respiratory failure, and in some cases, these young people were dying. Hence, the CDC became very concerned with this, and when they anticipated that this was going to become a pandemic, which means worldwide epidemic, they were very concerned that this would take on the proportions of something that we heard about in 1918, which was a different, it was also influenza A, but it wasn't the swine flu. Consequently, a week ago we were hearing things about schools should be closed, we should be very careful about large groups, and indeed we were concerned about whether or not we should have this tonight, because if we had a large group of people and there was a few people with flu-like symptoms in the audience, that maybe a number of other people would get sick tonight. But things changed. What we thought initially was much more aggressive and virulent seems to be milder. It seems to take on the portions of what we see with the usual seasonal influenza, and it doesn't seem to be quite as bad. A week ago, when I was taking on the idea about whether or not we were going to do this tonight, there was a quote that stuck in the back of my head, and the quote was, "Chance favors the prepared mind." Wasn't sure where the quote came from, so I Googled it, and it was interesting that I found that Louis Pasteur, who lived from 1822 to 1895, was actually the one who that quote's attributed to. Now, oftentimes we think Dr. Pasteur was actually a physician. He wasn't. He actually started off in chemistry, and through chemistry got interested in the idea of fermentation. And those of you that haven't eaten tonight will probably either enjoy a glass of wine later or a glass of beer. And Dr. Pasteur was somebody who improved the process of developing beer and wine, and I guess we'll have a toast to him later. He also determined that there's also a process that can stop fermentation, and that process actually carries his name, which is pasteurization. And he determined that if you can heat something up high enough, you end up destroying the yeast or the microbes that end up causing the fermentation process, which spoils milk or damages cheeses and so on. So we have something else to attribute to it. He also disproved something called spontaneous generation, which means that bugs like bacteria and viruses don't just all of a sudden happen from dirt, that they come from other living organisms, and that he proved that these microbes actually cause disease. He went on to develop a vaccine for anthrax because he was facing an outbreak of anthrax among cattle and sheep, and he was forced to use a rabies vaccine before he was ready to give it to humans to a boy who was about 9 years old who had been bitten by a rabid dog. So I think that Dr. Pasteur's quote of chance favors the prepared mind is something that we should just keep in mind tonight as we look forward to our panelists who are going to present this evening and try to elucidate some of the things about this H1N1 virus and how we should prepare to deal with it, whether it's now or whether it's in the fall. So our first presenter tonight is Dr. David Condalucci, who's an infectious disease specialist and a professor of medicine here at the school.
Okay, thank you very much. So thank you for inviting me tonight, and I appreciate the opportunity to talk about this. You know, in infectious diseases, Tim was talking about chance and opportunity, but in my lifetime, this has been an amazing trip, you know, because of some of the illnesses and diseases that I've seen in my lifetime that are new, and living through the AIDS epidemic and some of these seasonal flus and new discoveries of microbes. The swine flu is no different. These are very challenging times. We knew that we are due for a pandemic. We've been preparing for the avian pandemic. The government and all the agencies involved, and all the way down to hospitals and then schools and so forth, have been preparing for what we thought was the avian pandemic. And along came this as a trial run. It's been a very good opportunity to test our systems. And so the swine flu, while looks like, at least for now, we dodged a very serious bullet in terms of mortality here in the United States, it's been a good opportunity to test our systems, learn about the swine influenza, get an opportunity to talk about it. being prepared and how we may move forward with some of the challenges ahead for the fall and in coming years with this disease. So influenza is not anything new. History in infectious diseases is always very important because most of what we see is actually not new. There's historical precedent, and pandemics are not new in infectious diseases, and it goes back and may have even influenced history. It's thought that perhaps a pandemic influenced Charlemagne's army and caused serious illness. We had the first recorded pandemic in 1580 and another one in 1647. And then the big one that everybody talks about is the 1918 pandemic, which is a historical milestone because of the amount of people that were killed. And this quote here, I just thought I'd talk a little bit about it because it really gives you the essence of how serious a pandemic the Spanish flu was, and it killed so many people. But it started, it said that they were talking here about in a military camp, and they said these men start with what appears to be an ordinary type of a grippe or influenza, and when brought to the hospital, they very rapidly developed the most vicious type of pneumonia that has ever been seen. 2 hours after admission, they have mahogany spots over their cheekbones, and a few hours later, you can begin to see the cyanosis extending from their ears and spreading all over their face. It's only a matter of a few hours then until death comes, and it's simply a struggle for air until they suffocate. And then they go on to tell about the numbers, and it really was a milestone in epidemics. And if you really want to read a good book, The Great Influenza is a wonderful detail of pandemics, but particularly that 1918 pandemic. And while we've done some great things in medicine, there's some issues about how we perhaps, and physicians and so forth, weren't always there for some of our patients. Like many plagues, people left town, and there was others stepped up to the plate to handle some of these very serious and amounting deaths that were occurring. 21 million people died out of 1 billion people infected in the world. I mean, it's just an enormous number when you think about it, and everybody worries about that. Could we ever have another pandemic like that? And hopefully we won't. We've come a long ways from the 1918, because remember, not only did they die of influenza, but they died of secondary bacterial pneumonia. And of course, we have opportunity to treat both of those today in different capacities and supportive care. Influenza is one of those emerging infectious diseases, and the reason for that is because it changes and it has adaptability, and so therefore in vulnerable populations, as the virus changes, you become susceptible, populations become susceptible, and it can cause serious disease and occasionally a pandemic. There's a number of pandemics that have been described. In 1918, one was the most serious, but there have been others, and usually with every pandemic, there's large numbers of people died. Just to put it in perspective, on an average year in the United States, about 36,000 people die of seasonal influenza, and so that kind of puts these other pandemics in perspective, where you double or may beyond that, exceed that of increase in mortality. I think it's always good to remember that the pneumonia and influenza and related diseases are oftentimes like the 6th or 7th leading cause of death in the United States, despite all the abilities that we have with our antibiotics. Pneumonia still has a place. Osler said it was the captain of the men of death, and I think that that still remains very important in our considerations of the mortality related to pneumonia and influenza. The pandemic clock is ticking. We just don't know what time it is. We've been preparing for the avian flu pandemic The reason for that is because it's a virus that we don't have antibody to as a population. It's been confined predominantly to poultry and birds. There's been very little human-to-human transmission, but in fact, people and scientists were worried about the opportunity for that virus to spread and become a pandemic, and particularly because it has such a high mortality. The good news so far is that that has not occurred, but because of that, it gave us an opportunity to prepare. And so institutions in the state and various businesses have been preparing for a pandemic, predominantly the avian flu pandemic. Well, so far that hasn't happened, but we do look like we have a pandemic on our hands here. Perhaps not as serious, fortunately, but it does give us an opportunity to test the system and to learn about how we can, as a nation and a country and as countries, handle such a large outbreak. I put these next couple slides to show you how quickly influenza can spread in the United States. This is in August, it's the 57th outbreak. By September 14th, you maybe had a quarter of the country involved. By the 28th, maybe 2/3, and by October, the whole country was involved. So influenza can spread very rapidly in a matter of 6 to 12 weeks throughout the country. We're looking at an interesting paradigm with the H1N1 or the swine flu influenza right now, because you had all these people going to Mexico for spring break in the wintertime, getting infected and then coming back to different parts of the country. So you have outbreaks that are occurring in multiple spots throughout the country rather than just starting from one area and gradually spreading throughout the country. So it's kind of an interesting paradigm to look at it, kind of a more different way of the flu spreading throughout the United States. And of course, we'll just have to see how the full extent of it occurs. Influenza, I like you to think of it as a systemic illness with a respiratory component. Generally, when you get influenza, you're acutely ill. I mean, you feel terrible. It's sudden onset, headache, muscle aches, prostration, chills, rigors. You're very sick. Usually you can tell the time of day when you get it because of a sudden onset. That marked pronounced headache and muscle aches is because it's a systemic disease. You get a viremia from it. So you get virus throughout the body and the body's response to that. And so you're systemically, very ill, but because it also affects the respiratory system, and I'll let Dr. Braddis develop that further, but because of that, it has a respiratory component, and of course it can go on to pneumonia and death. Generally, in the United States, on seasonal influenza, we get about 5 to 20% of the population gets infected. We get 200,000 hospitalized, and every year when the flu is around because we have the hospitals are full and people are on divert. The hospitals are on divert, and you see the gurneys in the emergency room and in the hallways because we don't have enough beds. But then, the hospital flexes down after that as seasonal flu passes. And as I mentioned earlier, about 36,000 people die every year from the flu. And this is just an example of the seasonal bouts of influenza that we occur. And you can see on a regular basis the spikes that occur every year when we have seasonal influenza. Typically, as Tim mentioned, the incubation period is very short. So the flu is very easily spread, 2, 3, 4 days, quick person-to-person spread. It's spread by droplet infection, aerosolization, or person-to-person contact. And viral shedding begins a day prior to symptoms and usually peaks by the 3rd day. For the most part, between 7 and 10 days, you've gotten over the peak illness, and usually after 7 days, someone usually can go back to work. You can see that a typical sneeze or cough, you can aerosolize quite readily influenza. And masks are helpful. The surgical masks that you see are helpful in spreading this kind of droplet spread. They do not protect you against getting virus inhaled. You have to use, the N95 mask, but a typical surgical mask is very helpful in preventing this kind of droplet spread. So while it's not entirely protective, it does limit some of the aerosolization that does occur. So we would recommend that people, if someone is coughing that comes into your office, put a mask on them, and you should also consider wearing a mask if you're in a room with a patient. And if you don't have the more sophisticated mask, you can at least put a surgical mask on. One of the considerations, and still remains a concern with the swine flu, is if you get secondary bacterial pneumonia. And that can be quite serious. Secondary bacterial pneumonia, staph, pneumococcus, other organisms like Haemophilus can be the second, opportunity for death. So people that have chronic lung disease are particularly susceptible to this. And Dr. Braddis will go in more depth in that. I don't want to steal her thunder with that. But I do want to say that, we do worry about methicillin-resistant Staph aureus in this setting. We've seen it before. We've personally have had cases of secondary MRSA pneumonia and death from prior viral illness, and so it can be serious. So if influenza doesn't get you, the secondary bacterial pneumonias can. When you look at those that are highest risk, it's the extremes of age for complications, so children, pregnant women, the aged, people with other chronic medical conditions, kidney failure, heart failure, people that might have HIV, diabetics, people with transplants, people that are in long-term care facilities. That's a perfect spread opportunity. For example, if you got the swine flu in a nursing home, it'd be a great opportunity to just go right through that community and spread person to person. So that's why when you go into these skilled facilities, there's usually a sign on there, please, if you are ill, please do not come in. Make sure you wash your hands going in and out of the facility. If you have, if you're coughing, cover your cough with your sleeve or with tissues. Try to avoid hand contact. Well, we are trying to prepare for the big one. We thought maybe this might be the big one, but it doesn't appear that it's going to be as serious as initially thought. But the swine flu is just what it is. It's a respiratory illness that is described in pigs. It has a high morbidity and low mortality in pigs. But what happens is that it can cross over, and in this case, it can affect humans, and you get person-to-person spread. And that's what makes this so vulnerable, makes us so vulnerable, because it is a new virus, and we don't have direct immunity to this virus. Now, this is the map as of yesterday. There probably are a few more cases since yesterday. I checked it this morning. It hadn't changed, but I didn't do it right before I came. But in the United States, we've had 400 some odd cases, one death that's been attributed to a U.S. citizen. Sorry about that. Well, you're walking away with it. Okay, thank you. And you can see that it's really spread throughout the world. So that's all the right ingredients for a pandemic. The symptoms of H1N1 are very similar to seasonal influenza. Fever, cough, body ache, sore throat, chills, perhaps some nausea, vomiting, and of course respiratory failure. So it's very similar to seasonal influenza. There's a spectrum of disease here, from very mild disease to, as you know, in Mexico, where there were a number of mortalities. It looks like in the United States, we're mostly dealing with mild disease. I'm not sure why that's so. I think we'll just have to wait and see and learn more about this as time goes on. Sometimes as the first wave of flu goes through, it may be milder, and then the second wave that can occur oftentimes can be more serious. So we're just going to have to wait and see. But fortunately, right now, it looks like for the time being, we're dealing with a milder disease in the United States, which we're very grateful for. The World Health Organization has moved us to a phase 5, which means that there's widespread human infection. And so that it means that the world needs to prepare and act as though we have a pandemic. And so that's why they made a big deal about it. And of course, the concern, you've heard that maybe it was overhyped. Frankly, I think it was good that we were prepared here and that we don't really know. We didn't know at the beginning how serious this would be. And it was a good opportunity to create awareness and also to be prepared. Generally speaking, if you should acquire this, you should isolate yourself for 7 days. One of the things that I've heard on the news that we really don't want is we don't want everybody going to the hospital or to their doctor's offices. We want you to stay home. That's the safest place for you. What happens though is people come into the emergency room or go into physicians' offices, and frankly, if you got a good relationship with your doctor, a lot of this could be handled over the phone as long as they know you well. But we really don't want you to come in to crowded areas because that's the worst place for you. If you don't have it and there is an outbreak, that's the opportunity for you to get infected. It looks like the drug Tamiflu and Relenza are effective against this swine flu. It quickly became difficult to get Tamiflu in the community pharmacies. The federal government took control and stopped shipping to the local pharmacies, and the states are the ones that now have Tamiflu. What we tried to do is, particularly for some of my high-risk patients, my AIDS patients, I wanted them at least have Tamiflu on hand, and for a few days we were able to do that in case they got sick. But now most of the pharmacies, at least in this area, don't have any Tamiflu available. The hospitals usually have some reserved, and the state, I think, has about 1 million doses that are available for treatment. If someone should be seriously ill and require treatment, usually you want to give Tamiflu within the first 24 hours to be effective. If you have the flu, you want to try to stay home and isolate yourself. The worst place for you people to be in a pandemic would be in crowded areas, the malls, sports events, gatherings like this, schools. And you can see that initially the federal government suggested that the schools be closed. They've eased that restriction now since it looks like this is a milder form of the disease, but it made good sense at the time because it quickly could spread through a school. You saw what happened up in New York and how many were sick there. And if it had a high mortality, you could have serious outcomes under those circumstances. So the best place for you is to be home, don't travel, and stay in an environment that minimizes contact with people. We want you to get your annual flu shot every year because you can have more than one pandemic going on at a time. You can have your seasonal flu, and then you could also have the avian flu going on at the same time. So if we vaccinate enough people, we can minimize at least seasonal influenza. So every year we make a strong push for that. This year we had about 40% of the people at Kennedy Health Systems get the flu shot, which was better than other years, but still it's not good enough, and we should encourage people to get vaccinated whenever they can. The ones that are at greatest risk are children, the elderly, chronic diseases, but healthcare workers. We want as many people vaccinated every year as we possibly can, and these are your high-risk groups. I won't dwell on that. If you have an opportunity to be vaccinated during a pandemic, these are kind of the priority groups that would get the vaccine first: healthcare workers, and then high-risk contacts, key government officials, I guess you could debate that, and then the rest of the population. So you know, that's kind of the triaging of the way people are going to get the vaccine if and when it becomes available. I'd like to conclude with that and just say that we were very fortunate so far that we've got a milder disease than which was originally thought in the Mexico outbreak. I think we still have to wait and see as this evolves. Many more people are going to get swine flu, and there will be deaths. We do have a good opportunity to minimize it because we're coming into the summer months and there's less crowding and less congregating in closed environments, so that gives us a good opportunity to you know, limit the spread of this disease. We'll have to see what happens in the winter in the southern hemisphere and how it reacts down there, and that'll give us an idea of what we're in for this fall. Hopefully then we'll have an opportunity to have a vaccine available at that time, and we can begin to vaccinate our population and minimize the spread. It certainly has been a good opportunity, though, to test the system, and we've learned some good things about that, and we've also learned where we got some holes and where we can do better the next time around. So again, I'd like to thank the Dean and the school for the opportunity to talk to you today. And I believe they'll take questions at the end of the panel discussion. So thank you very much.
We'll have all the panelists up here at the very end, and they'll be happy to answer any questions that you have. So our next presenter is Dr. Olivia Breitis. Dr. Breitis is a pulmonary critical care specialist in the Department of Medicine, and she's also the medical director for the intensive care unit at Kennedy Memorial Hospital Stratford Division. Dr. Breitis.
Thank you. Good evening. I think tonight we'll be hearing a little bit of repetition, but we all know from medical school that repetition is key to learning, so I'll try and graze over the repetitious parts from Dr. Condalucci's presentation, and I'm here to focus a little bit more on patients with chronic disease, especially pulmonary diseases like asthma and emphysema, and what particular risks those people have in front of them in terms of the swine flu outbreak. So basically, what is swine flu? We've been through that it's basically an H1N1 Influenza A virus. It's a new flu and a very contagious flu. It spreads very easily from person to person, which makes it very likely to be involved in an epidemic or pandemic. And our immune systems really aren't very good at fighting this virus because it's really never been seen by our immune systems before. Therefore, the seasonal flu shot that we get obviously does not protect us. The difference between this flu that we were worried about a week ago and the normal influenza A is that it has killed young, healthy people, as Dr. Dombrowski alluded to earlier. And this is not usual, whereas usually influenza A affects patients more with chronic disease, at least more severely. We went over the symptoms, so I won't belabor the point that it includes fever, tiredness, muscle aches, lack of appetite, and cough, along with some other systemic complaints. And we really how do we catch the swine flu? Obviously, the virus lives in our saliva and mucus. And when you aerosolize these droplets, they can be inhaled, especially after a cough or a sneeze. The droplets can also live on surfaces. So if you cough or sneeze into your hand and then touch surfaces, and then someone comes along and touches those surfaces after you, they can certainly contract the disease if they transfer that to their mouth or nose or eyes. And you can see why that would make hand washing and alcohol-based cleansers so important to continually wash your hands and practice good hygiene. I think one of the most common problems in the community is going to be, how do I know if my cold here is swine flu? And Dr. Condalucci kind of alluded to what we don't want, and that's everybody who has a stuffy nose to be running to the emergency room to get tested for swine flu, because it's certainly going to put us at greater risk for a pandemic. because, as he said, it's much safer for us to stay at home. So you should know that you have a greater chance if you've recently visited an area where the swine flu is proliferating, or if you've been in contact with someone, obviously, who's known to have the swine flu. Patients who have common cold symptoms that come on slowly are more likely to have common cold, and they should really stay home and treat their virus with fluids and rest until they feel better, and then go back out into the community. Because you're certainly, if you don't have the swine flu, you'll be immunocompromised and more likely to get more serious infections if you have a common cold. If you have the previous more virulent symptoms that are suggestive of swine flu, you should certainly call your doctor and, if necessary, present to the emergency room. So here's a little bit of a slide to kind of tell us what's really the difference between the common virus and influenza A or swine flu. Fevers are usually rare in the common cold, and in fact they can be quite high and last for a few days in influenza A. The symptoms come on suddenly, and generally they're more severe. Headaches and muscle aches and pains are generally very severe and come on suddenly, whereas in the common cold they're really quite mild. You often get runny, stuffy nose and sneezing more commonly in a common cold than you do with influenza. But other symptoms you can see can be quite similar. The basic bottom line is your symptoms are going to be much more severe and come on much more suddenly in influenza A than they will in the common cold. What's the treatment for swine flu? I think we're all in agreement that mild cases really probably don't need medication. And what we should do is the same thing we do when we catch any other kind of flu, is stay at home and rest and prevent ourselves from getting super infected and prevent the virus from being spread from person to person. Symptoms even of the swine flu or influenza A will resolve usually in 1 to 2 weeks. More serious cases, we alluded to earlier, can be treated with antivirals like Tamiflu and Relenza. And usually they work better if they're taken within 2 days of symptoms. So if you feel a sudden onset of fevers of 103, shaking rigors, you're suspicious for this, you talk to your doctor. If you get this antiviral within the first 2 days, you should really have a less severe illness, and the illness should usually get better quicker. Antibiotics will not work for any kind of viral infection because all of our antibiotics are used to treat bacteria and in fact have no efficacy against any type of virus at all. And Dr. Condalucci already told us that we don't have a vaccine for this particular strain of influenza A yet. So you might ask yourself, how can you protect yourself and your family from swine flu? The most important thing is good hand hygiene. Wash your hands properly. Wash them often. If you're unable to get to a sink and you've been coughing or sneezing or touching things, it's good to use alcohol-based cleansers, but know that to kill all the virus and bacteria, you need to use the cleanser for a prolonged period of time. If you're going to cough or sneeze, you know, it was always said it's polite to cough or sneeze into your hand. In fact, that's kind of the worst thing you can do because then you're touching everything else and spreading the virus. So really, when you cough or sneeze, it's recommended that you do so into your sleeve so you have less likely chance to spread bacteria or viruses from your hand to surfaces. If you're going to cough up your mucus, spit it into a tissue and wash your hands. And avoid touching your eyes, nose, or mouth in public. So if you're touching things in public or you're exposed to a lot of people or large groups of people, it's best to not rub your eyes, touch your nose or mouth if at all possible. And of course, number one is if you're feeling sick, stay at home. So a little bit of what I'm going to focus on more tonight is for those patients out there who have chronic lung diseases, because that's sort of what I deal with on a day-to-day basis. So if I have a chronic lung disease, should I be more concerned with the swine flu? Absolutely. Patients who have asthma or COPD are definitely more likely to catch any type of influenza. That's why we recommend that they get the flu shot every year. And they're more likely to get sicker than your average person in the community. What they should be doing is doing all the previous steps that we went over about washing your hands properly and controlling germs. And it's really very, very important to ensure that your chronic illness is under good control. So that means taking your medications as prescribed by your doctor, making sure that you take all your maintenance therapies for your asthma or emphysema. And in our time of financial hardship here, where it's difficult to afford all these expensive maintenance inhalers. It's important to be honest with your physician whether you're taking these medications or not. Perhaps you can get samples in the office to get better control, or perhaps we can look for a more cost-effective way to get control of your chronic lung disease. And it's often helpful to have extra medicine on hand at home in case you go into an exacerbation of your chronic lung disease or chronic heart disease. And I'll talk a little bit more about action plans in that regard. So why are these chronic lung patients more likely to get sick than regular people in the community? Well, number one, if you have asthma or emphysema, you could have abnormal lung architecture. So you see here on the left, this is a microscopic picture of our normal airways, and you see those little filaments. They look like, I don't know, like little whale teeth that kind of filter bacteria. And what they do really is they filter bacteria up and out of your lungs. So that's our own body's natural defense mechanism. If you inhale things, then normal lungs will use these little bristles to kind of push those bacteria and viruses up, and you'll cough them out of your lungs and you're less likely to get an infection. You can see on the right here is an example of a patient who has chronic lung disease, in this case chronic bronchitis or emphysema. That patient has lost those little filaments. So the bacteria are less likely to be expelled. So you can see that they'll sit in the lung and be more likely to cause infection. In fact, patients who have emphysema or uncontrolled asthma, they get inflamed airways, thickened, and even damaged airways. So it's less likely that our natural immune system can provide cells to that damaged lung in order to fight off infection. And of course, these patients have more mucus glands than normal, and more mucus is just food for bacteria and virus. You have increased mucus production and decreased ability to clear the mucus, and it sits there as a little petri dish for the little viruses and bacteria to grow on. This is a little snapshot of why these patients are at greater risk. They have their natural defenses are in jeopardy. In fact, they already have a lot of inflammation in their airways. And these patients are definitely at more risk, as Dr. Condalucci kind of alluded to, for increased chance of bacterial superinfection. And that's often what does patients who have chronic illness in, is that they get this first onset of a flu-like illness, and then they have a harder time getting over it because of their chronic lung disease. And all that mucus serves as a perfect media for a bacteria to come in and give them a very virulent bacterial pneumonia when they're already immunocompromised. And oftentimes, if your chronic lung disease is not under good control, then you have a decreased pulmonary reserve. Whereas I could, have a decrement in my breathing right now. If I lost 75% of my breathing function, I could probably just lay in bed and I'd be okay. But if you're really doing poorly as a baseline and you lose 75% of your lung function, then you're in big trouble. So decreased pulmonary reserve is a concern for why these patients get much, much sicker. And of course, it takes them a much longer time to recover from an infection than someone who's normally healthy. What else can you do to stay safe as a chronic patient? People who have immunocompromising chronic illnesses like uncontrolled asthma, HIV, congestive heart failure, chronic kidney disease, they need to be more prepared in these kind of situations even than a normal person. And it's important, like I said, to keep your chronic illness under control, especially people with lung disease. And it's important, especially with lung disease, to formulate action plans ahead of time in conjunction with your doctor about what to do if you start to develop symptoms of any kind of exacerbation of your chronic illness. And in this regard, it's helpful to keep extra medications on hand so you can have a quick application of your action plan. I'm sure, as hard as we try, a lot of times doctors don't call you back right away, so that you have some medicines on hand and you've already talked before with your doctor about what your action plan could be. So as a chronic lung patient, you might ask, what is an action plan? Well, really, it's just creating guidelines with your doctor about, number one, what's your baseline? What is your breathing when it's the best? If you have the asthma, you might know what my peak flow is when I'm feeling healthy. If you're a COPD or an emphysema patient, you might say, this is my baseline shortness of breath. I can walk up a flight of stairs without getting short of breath. Or I produce a small amount of mucus in the morning and this is normal for me. Those are your baselines that you talk to your doctor about. And then you would create plans with your doctor about what happens if you have a change in this baseline. If you have an increase in your shortness of breath, no, now I can't walk to the bathroom and back without getting short of breath. Or my mucus changed from clear to yellow to green. These are the kind of changes that you might be looking out for. And you should have action plans in this regard about what to do. And you should also establish time frames to say, well, I'm going to do this, but if it doesn't work in 24 hours, then I'm going to seek a higher level of care, call my doctor, go to the emergency room, so that you don't wait until your disease escalates so much that you get severely ill and need to be hospitalized. This is just a quick example that I downloaded of a sample action plan for an asthmatic. And this doesn't work very well, but you can see the green zone up here would have a peak flow range of in your normal, and it tells you what medications that your doctor prescribed for you to keep your asthma in good control. When you start feeling sicker, you're waking up in the night with asthmatic symptoms, or you're coughing or wheezing more, or your chest feels tight, and your peak flow goes into this range, then you're considered yellow. If that happens to you, then you've already decided with your doctor that you're going to initiate, extra inhaled therapy or oral steroid medications or antibiotics or whatever you've decided. And in the red zone, if you wake up and you're really, struggling to breathe and your peak flow is whatever, then you would immediately call your doctor and start your therapy that you've talked about until you can get a call back or until you can get to the emergency room and be seen by an emergency doctor. So what types of therapies might be involved in these action plans? Sometimes additional inhaled therapies, sometimes antibiotics, sometimes oral steroids. Even in times of a pandemic like this, you may have guidelines with your doctor about when to start antiviral therapies such as Tamiflu. And it gives people with chronic lung disease some control over their disease. And it helps to prevent symptoms from escalating before people can seek additional medical therapy. So really, in summary, we can say that influenza A is not a new problem, and that the swine flu strain may be new and particularly dangerous. Patients with chronic lung disease are definitely at a greater risk of infection with the virus and of serious complications of the virus. But even without a vaccine, we can certainly be prepared with good prevention strategies and early action plans to prevent escalation of disease. Okay.
Okay, our next panelist is Dr. Jackie Carey, who's our acting chair for pediatrics here at UMD. Jackie.
Thank you. Welcome to everyone tonight. What I'm going to talk about is the pediatric perspective. I'll try not to repeat some of the information that we've heard previously, but talk a little bit about how this influenza affects the pediatric patient and just influenza overall. Now, when you talk about influenza in children, children don't always exhibit the typical symptoms that you see with the flu. So we've gone over those symptoms, and sometimes you will see some different symptoms with children. Children less than 5 years of age or children that have chronic conditions are at the highest risk for complications. And there's usually an average of 92 deaths in children per year due to influenza. Again, co-infections or secondary infections can be common, with Staph aureus being the most common, and also an increasing rate of infection with MRSA. And one of the other differences with children is that they may be contagious longer than the 7-day period that we see with adults. So children can be contagious for 10 days or longer. These are a list of the signs and symptoms we see. More often with children, we may see some vomiting and diarrhea, also fever and fatigue. These are the warning signs. If parents call, they want to know what's the difference between some of the things that I'll see with influenza or with the swine flu and what happens with the normal virus. Well, these are some of the warning signs that, of course, we see in children that clue us in that something more serious is going on and that we need to intervene more than just supportive care. Of course, difficulty breathing is a very important thing that we look for in children. more common in children with asthma, underlying conditions, and also very young children, just due to the fact of their anatomy, that the lungs are smaller, the bronchioles are smaller, and they can tend to have more problems with respiratory illnesses. Dehydration is also important when children get ill, they're not feeling well, they're irritable, they don't always want to drink fluids, they're tired, they're sleeping longer. So we have to be alert for all the signs of dehydration. Being inconsolable is also something that we need to look for in children. Children will be irritable and fussy when they're sick, but usually when a parent or a loved one picks them up, cuddles them, tries to give them a little comfort, they usually will feel better. If that doesn't happen, then that's also another sign to alert us that things are more serious. And then also with the influenza and with the swine flu, these symptoms can come on, they can improve and then recur. And sometimes that also is a warning sign. Our treatment, we've talked a little bit about supportive treatment. That's very important in children. We want to control the fever. We want to use Tylenol or acetaminophen and NSAIDs for that. Be sure to continue to caution parents not to use aspirin or bismuth salicylate, which is what you find in Pepto-Bismol. When children have these type of symptoms, parents want to do something, especially with GI symptoms, to help them feel better. So we need to make them aware that this is not something they should use because of the risk of Reye syndrome. Chemoprophylaxis can be used for household contacts or children that are less than 5 years of age, since they are at a greater risk, or for children with chronic medical conditions. And then we also would treat children that have the suspected infection. Children can be treated in much the same way as adults. Tamiflu is found to be effective in children, and we can use it in children that are 12 months or older. We have 2 differing doses with children, one for chemoprophylaxis, a different dose for treatment, and we also change the dose, of course, based upon the child's weight. Children's weight will vary depending upon their age and their rate of growth, so it's important that we change the dosages and look at the children's weight. Now, the Tamiflu is available in capsules, and we can use that with older children, but then it's also available in a suspension, so that will make it easy to use if it is needed. Relenza can also be used in children 5 years of age and older. For prophylaxis, it can be used at 5 years of age, but for actual treatment, it's recommended to only be used in children 7 years of age and older. Now, one of the questions that comes with using these medications is, what are some of the side effects? Now, we've not used these medications with this specific swine flu and what has been going on now, but that is a question that parents would have if we did need to consider treatment. You want to look at the risk-benefit. Children under 1 year of age are actually at the highest risk for complications, and the medications have not been licensed for their use. But there are some dosage recommendations for Tamiflu in children under 1 year of age. And there again is a dosage for prophylaxis and a dosage for treatment. All of these dosages are available on the CDC website. So as far as the flu we're seeing now, in the future, or even in future risks of pandemic, you can always find the specific dosages that you need. Now here's just a chart that shows a little bit of the side effect profile. Tamiflu doesn't seem to have many side effects when we look at what can occur with children. There can be some confusion and some self-injury, which has found to be increased in the child or the adolescent population. So that's just something that we need to be aware of. And then with Relenza, there seems to be more side effects. and the most serious one being bronchospasm. So you wouldn't want to use this in a child that had a chronic respiratory condition or asthma. Now, when we look at breastfeeding as far as being protective with flu, breastfeeding is actually being recommended. It is found to be highly protective, and mothers are given the counseling that if they are exposed or if they actually have influenza, that they should not stop breastfeeding. They should continue to breastfeed. They should limit any formula feeding, and even if they're not well enough to breastfeed on their own, they should pump and then give the express breast milk to the child. And even if they're being treated for influenza, they should not stop breastfeeding. Another concern with children with influenza and with looking at a pandemic is schools and child care facilities. Now, we already talked a little bit about how these recommendations have changed even over the last week. The initial recommendation was to close a school if there was one documented case. This has been updated as of May 4th, and now we are just looking at keeping an eye on schools if there is a suspected or confirmed case, but not actually closing the school or closing the school for 7 to 10 days for any cases. We have had a few schools in the area that have closed, even one school that closed when they have had no cases. So hopefully some of this hysteria is starting to die down, so we're not seeing any of the school closures when they're not really necessary. But again, as was stated before, it's not a bad thing that there has been this heightened awareness and that everyone has kind of looked at their systems, has communicated with parents, with staff, and also with the health department, so that we know these systems are in place and we know what to do when we do have a public health problem. Children and faculty and staff should stay home for 7 days if they have symptoms of the swine flu, or until, if it's longer than 7 days, until those symptoms have been gone for at least 24 hours. If a child or a staff member comes to school and they're found to have those symptoms, they should be isolated and sent home. The other thing that's important with child care centers and for schools is to communicate with parents that when these dangers and situations become real, is that they need to have alternate child care available for their children. Because if the school closes, if the child care center closes, they need to either be able to do some of their work at home or to be able to have alternate care for the children. Because this is something that could occur if we do get a pandemic where it becomes more widespread in our area. Education is very important. It's important as pediatricians for us to discuss these measures, these safety measures, sanitary procedures with parents and also with children. Children want to be involved. They want to be empowered to be able to do some things for themselves. So in our office, we have been stepping up our talks about infectious control. We have information that we give to the children themselves about coughing into their sleeve or sneezing into their sleeve or into a tissue, and then also a greater emphasis on hand washing. So in our office right now, everyone is sneezing into their sleeve right in front of the doctor to show that they're listening, and they're also all wanting to wash their hands all the time. And I think one of the best things with kids is that we want to be a good example. So they want to see us doing that. I'm making more of a production of washing my hands in front of the patient so that the parents see that, the patients see that, and then that's a good source of modeling. We want to be careful with children. In addition to the physical problems, children can be affected psychologically by this type of illness and by widespread panic and hysteria that can go on with this. As we all know, the media goes into overdrive, projecting things that don't necessarily occur, and really looking at the worst case scenario. So parents, healthcare workers, and in the school, we need to be calm and reassure children so that they don't feel like they're going to die, everyone they know is going to die, their parents are going to die. So I really want to be calm and reassure them. Take time to talk to them about these things, give them facts that are age appropriate, and also review the hygiene practices with them, as I had said about hand washing. And also just to tell them, we're going to do this more often. We're going to wash our hands, we're going to use the hand sanitizer, we'll put one in the car, we'll have one in, put one in your pocket, in your lunchbox, so the children realize that with all this going on with increased illness, that we're also doing some new things to help take care of it. And by doing some of these things with children, also, of course, limiting their media exposure. You don't want them to be constantly bombarded with everything that's on the news, because that will increase their anxiety. And these can help with children as far as the psychological ramifications of the illnesses. And as we talked about before, opportunities. As a pediatrician, we're always looking for opportunities. We always try to look at the glass half full. And these are teachable moments that we can talk and improve our infection prevention. It's also an opportunity for us to highlight influenza and the importance of the yearly vaccine. There's a lot of misinformation about vaccines. Vaccines are something that we spend a lot of time talking to parents about. There's a lot of controversy about the influenza vaccine and whether parents feel children should get it on a yearly basis. In New Jersey, it has been required in all children under the age of 5. So this gives us an opportunity to look at influenza in a different light, where parents can really see that not just what we're looking at now that's been termed the swine flu, but that influenza every year affects many children, many adults, and does cause deaths. And then it also gives us the opportunity to also talk about breastfeeding education, the role of antibodies, and to encourage that in our moms. Thank you.